So kind of leading into this, why does it matter? These are some of the many papers showing the problems with this. There's a huge mortality associated with this. A lot of the papers are showing now that it's similar to a matched cohort with hip fractures, 20 to 30% mortality rate at a year. These people get loss of autonomy. There's prolonged hospital stay, and obviously the economic costs for this. This is a little bit older paper, but again, showing just the economic cost with this. And so if we can eliminate a couple days for these patients or get their disposition home rather than go into a skilled facility, it helps a lot. The other problem that we've been running into is just the complexity of these patients. So they're decreased bone quality, but also they're increasing severity of their injuries. So this used to be these kind of what you think of the low energy geriatric patients, but now these 80-year-olds with bad bone are getting in car accidents, or they're getting more significant injuries that require fixation. So what we do is we have a fragility fracture consult service, and we have a full-time nurse practitioner that's been great. Every single one of these patients that gets a pelvic ring injury, the elderly patients, gets a consult and is seen by her in clinic. Obviously the unstable fractures get operative treatment. We've been trying to develop a protocol with Dr. Christ and with the research committee of how we're going to manage this. It was a little bit of a hot topic last night talking about this. But in general, we give these patients a couple days. We give them pain control with a goal to ambulate about 100 feet. And then if it's really pretty obvious the ones that can get up and get out of bed and the ones that can't. And the ones that can't get out of bed we talk about fixing, and we let them all weight bear is tolerated immediately, particularly for the geriatric patients. And if they can't get up and get out of bed, then we'll trial non-operative treatment. But the CurvaFix has kind of changed the way that I've started treating a lot of these elderly fractures, and it's another tool in the bag